Hi, I'm Dr. Tan Yiping. I'm a consultant obstetrician and gynecologist. So today we continue with our series of live topics on cancer prevention. Patients with endometriosis also have estrogen dominance, but in a slightly different manner. Okay, uterus cancer is uterus cancer. It is a slightly different manner, but in a way true. That's why number one, we do know that because endometriosis patients usually develop ovarian cancer. And then ovarian cancer, uterus cancer, they're also very much related. So when you have uterus cancer, you also have high risk of ovarian cancer because all also due to the imbalance between estrogen and progesterone. So when you have PCOS, you have higher estrogen, so you have higher risk of uterus cancer. In fact, I would say that almost all the uterus cancer women actually have PCOS, especially the young ones, those who get in their 20s or 30s, okay? Definitely. That's why most of PCOS have diabetes during pregnancy, and when they grow older, they have diabetes. You see, these things are all linked, it's over the years we find out. And we now know already PCOS and diabetes is the same thing. And so, when you get PCOS, then when you're pregnant, also high risk of diabetes lor. Okay. But honestly, there are more diabetic women than PCOS women out there, so there's more to it lah, okay? There's no difference whether you're single or married, whether your estrogen level is okay or not. Okay, of course you can test, but honestly, it is not a way to detect that you have high estrogen level because it's always between estrogen and progesterone balance. And this balance it changes every day. So I cannot do your blood test every day, right? So once you have those signs, you know you're obese, you know your period's irregular, you know you have diabetes, then your estrogen is most likely dominating your progesterone. So you better take care and make sure you prevent uterus cancer. Because I personally also have PCOS. My parents, both my father and mother, also diabetic. So you can see I am definitely high risk of diabetes, right? So I'm also at high risk of uterus cancer. So you see, I have all the signs. So what I did after my last baby, I put progesterone in my uterus. So I put progesterone in my uterus, I don't need to worry for the rest of my life. I won't get uterus cancer. I live in peace. And I also do not need to worry about side effects of progesterone because I know that progesterone in the uterus is very safe. It's focused and concentrated at the uterus. So you don't have to worry about the progesterone in your bloodstream causing other problems. Okay, number one, I have to tell good news to you because utrogestin is progesterone. Just now I mentioned if you're on long-term progesterone, you're protecting your uterus from uterus cancer. Okay, so does IVF treatment cause uterus cancer? No, because normally you have a combination of both. In fact, the early stages when you take a lot of injections, yes, because that time your estrogen level will be very high. But after that, you see, your doctor will put you on utrogestin, which is purely progesterone to counteract. So if you really follow the treatment regime, it's not a problem for a few reasons. Number one, even if you have a lot of estrogen during the early injection phase, it is only for 1 month ma. You don't do IVF for 20-30 times, right? So you don't have to worry, only 1 month, don't worry, okay? In fact, one thing I didn't mention is estrogens that women take on their own. That means not by doctor one, There are actually a lot of women who are taking estrogen without you yourself knowing estrogen. Why? Because estrogen make you young. Estrogen make you beautiful. Estrogen make your breasts bigger. Estrogen gets rid of a lot of pains in your body. So you see, sometimes there are a lot of supplement, herbal out there. Okay, be very careful because all this can contain estrogen. Okay, so actually there are a lot of women who take estrogen on their own one without realizing. That's why I always tell women, any supplement or herbs out there that women take, men cannot take, you better think 10 times, 100 times before you take, because very often got estrogen. That's why men cannot take ma. like an implant like that. It's a plastic thing inside my uterus. It can last for 5 years. I already have it for 14 years. So every 5 years, I take out the thing and put a new one. I renew every 5 years. Until when? If I don't want to get menopause, if I don't want to get uterus, until I menopause. And then I also don't want to get pregnant. So I say, look, kill two birds with one stone. I put this thing, I don't get pregnant, and I also don't get uterus cancer. And this thing, Mirena, that we put inside the uterus, it is 99.9% safe for pregnancy. It's the safest method to prevent pregnancy, and yet can prevent cancer, and yet hardly any side effects because it doesn't go into your bloodstream. So that is the perfect progesterone to prevent uterus cancer. So thank you very much. So if you have anything that you want me to talk on, just put it in the comment section or PM me directly with the topic, that I will seriously look into it. And I hope I have shared enough all this while. So that's all for today. Okay, bye bye.